This is live on KETK. Aortic stenosis is the most prevalent form of valvular heart disease. Joining us to talk more about new treatments is Dr. Tolleson with TAVR Cardiovascular Consultants and the ETMC Cardiovascular Institute. Welcome.
Thank you.
Well, first tell me a little bit about aortic stenosis.
So aortic stenosis, there are four valves in your heart. They're like doorways between the chambers of your heart, and your aortic valve, if you use the analogy of your heart like a house, your aortic valve is the front door. Every time your heart beats, your aortic valve opens and lets all the blood flow out to the rest of your heart.
So why do people develop problems with their aortic valve?
That's a great question, and that's the first question many patients ask when they come in for evaluation of this. Most of problems with your valve, specifically your aortic valve or aortic valve stenosis that we're talking about this morning, are age-related. In other words, the analogy I use with patients is just as our knees and our hips, our joints and other parts of our body wear out with age, our aortic valve wears out as well.
Okay.
Most people's heart beats about 100,000 times a day, so
wow,
more than most people realize. So by the time you're in your 70s, most people's hearts have beat over 2 billion times. So that aortic
wow,
valve has opened and closed over 2 billion times. And so it's not surprising that it develops wear and tear on it.
Well, I know that y'all are offering a new treatment, but how would you have treated this problem in the past?
Traditionally, over the last 40 years, the treatment for aortic valve stenosis, just again to use the analogy of knees and hips and joints, is that it was replaced. Once it wears out, the aortic valve was surgically excised and was replaced with a new aortic valve. And so that was open heart surgery, as most people think about it.
Okay.
And so they underwent open heart surgery, their old aortic valve was taken out and a new aortic valve was surgically implanted.
And this new treatment, what does that look like?
So the new treatment, it's called, as you mentioned, transcatheter aortic valve replacement, or TAVR, TAVR for short.
Okay.
What has happened over the last several years, the last decade, is the same aortic valve, it's actually made by the same company that makes the surgical aortic valves. We've been able to miniaturize this technology to the point that instead of doing a surgical incision and opening their chest, we can actually take it through a small incision in their groin.
Oh, wow.
Again, to use an analogy most people are familiar with, everybody's familiar with how we open blockages in heart arteries with stents now. We take those through a small incision in their groin up to their heart. The same technology has now been developed where we can take an aortic valve through a small incision in their groin, take it up to their heart and implant it in their heart to replace the aortic valve that's worn out.
That's pretty crazy. So in terms of patient care, it's much less invasive.
Exactly, and that's the major advantage. Even though, and you always need to mention that surgical aortic valve replacement is still the treatment of choice for the great majority of patients, but as our population gets older, obviously older patients with other medical problems are higher risk to undergo this. And so this was developed to treat a group of patients that were high risk for surgery, or as we've seen in the patients that we've treated at East Texas Medical Center now, have been refused for surgery because they were simply too old or thought to be too sick to survive surgery. And these are patients that are now leaving the hospital 24 to 48 hours later.
Okay. Well, real quick before we go, how do you know if you're the proper candidate for this surgery, and where can you get more information?
Great question. So anyone with aortic valve stenosis, what we recommend now, we actually have a comprehensive heart valve clinic at East Texas Medical Center. So instead of being seen by a cardiologist or by a surgeon, we have a team approach to where they're seen by a group of cardiologists and surgeons as well as imaging specialists together, so that whatever the treatment is, whether it's open heart surgery, minimally invasive surgery, TAVR, we can look at each individual patient, and since we offer all of this now, we can individualize it for specific patients.
Awesome, awesome. And more information is available on the website?
On the website, etmc.org/TAVR, or you can Google it.
Wonderful. Thank you so much.
Thank you.